Welcome to the American Academy of Grief Counseling's video on attending the client fundamentals. And this would be qualified as a part one episode in a series of, I believe, 6 or 7 videos, which we're going to be doing. And these videos are going to help many in the grief counseling program, as well as our other counseling programs, maybe in crisis, anger, spiritual, or Christian counseling programs. It's going to help you apply what you've learned and be able to utilize it in a counseling session. Now, bear in mind, there are 2 types of counselors that can be certified through our organization. Those are that are clinically licensed, and they are able to do therapies that are beyond basic loss, that deal with pathology in grief. And then there are more of the pastoral level counselors who are not licensed, but deal with just basics in grief, just with basic problems that are not pathological. So this part one is to give some micro counseling skills, some basic skills in attending the client, and then we'll go through a couple others and how to respond and how to encourage and how to work with a client. And I think this will be very helpful for many who might not have any counseling experience just because they're coming from a pastoral background and they're not coming from a clinical background where they already have hours working in those fields. So again, attending is the term that we use when we speak about meeting the client, working with the client. We are attending them. We are forming a relationship with them. So a counselor makes him or herself available to the client. He invites or she invites the client into this professional and therapeutic relationship. And the attending skills are the initial phases of client interaction with the counselor. So how well a counselor attends the client through listening, observation, and feedback will really tell the story of how well the client responds to counseling itself. You could have a PhD's worth of knowledge in psychology, in grief studies, but if you're not personable, if you don't have a bedside manner, and if you don't attend and observe and listen properly, then the client isn't going to establish a sense of safety, a genuineness, a sense of trust to be able to open up and to discuss issues. So when we are attending, we want to be actively and empathetically listening and also observing for various cues that tell us about the client's state of mind. During this very important phase, the counselor should not talk as much. They should have some simple responses, but the main key is letting the client tell their story. And it's important to emphasize that at this point, it is their story. It might not be the real story yet, which we'll discuss in other videos, but it is their story, and it's important to understand where they are coming from. So good attending skills are critical in this. It enhances better client outcomes and shows the client that the counselor has an invested interest in the client's problem. So it is very important, as Carl Rogers points out, to be very empathetic, especially in this attending phase, and to be very client-centered in the approach and how the counselor listens, observes, and eventually responds in itself. So if we are attending someone, one of the first things that we need to look at is the body posture of the individual that is talking across from us. There are many nonverbal cues that play a key role in counseling that the counselor, as a detective almost, can find. So this involves looking for various things in terms of the person's eye contact, how well you are looking at their face, their facial expressions, and also how, not just how they are responding, but how you are responding to them. How's your positioning in your seat? Are you leaning forward, which shows a little bit of interest? Also, your vocal tone. You can sound very disinterested by just your tone of your voice in itself. Now, in terms of the counselor's eye contact, if you're looking away while the individual's talking, or too busy writing too much, or looking out the window, this can cause serious problems for the individual because it shows that you are not interested in their story. So you do not want to show disinterest, but you want to show the utmost interest and captivation in their actual story. You're captivated by it so that they feel that you are an interested listener, one who cares about their story. So their body posture, what they're giving to you, and your body posture are critical. Think about it. When two people are engaged in a stimulating conversation at a restaurant or in a lobby, you notice that because of these little cues that they show between themselves. You can also notice the exact opposite when there is a lack of interest. So the art of listening involves a good conversation. And that good conversation means listening and also adding feedback when it is required. It involves connecting and mutually influencing each other. It's not only a monologue, but a shared party that each party invests themselves in. So a counselor needs to pay attention, not partly listen, and not just merely repeat, mirroring, or parroting, which can be demeaning and patronizing to some, but actually through their listening, be able to have a few comments that show empathy, that show that they are listening and reflecting what is being heard and sent back to the client. A client also needs to have a counselor who refrains from making judgmental comments or biases that exist within. So a counselor needs to remove sometimes him or her own filters that exist within one's own background when first talking to an individual, especially individuals that might be culturally or socially very different from the counselor, him or herself. So a counselor needs to filter out preconceived ideas about the individual when they're listening. And they also need to maybe knock out any type of preconceived diagnoses. So if a counselor meets an individual and they already have an idea that the person's depressed, or the person was brought to them and they were already been told that this person's depressed, this preconceived notion can influence the art of listening and not give a very good outcome in that. So you want to listen to the story being told. Counselors also, when they're listening, need to avoid rehearsed and prepared lessons. So when counselors go to psychological and counseling schools, they do a variety of filmed practices with fellow students or volunteers. Some of them are scripted, and they learn what to say, what to respond to. However, when you're actually counseling someone, you can't just have rehearsed lines. The listening and the art of listening has to be in the now moment, has to be in the now moment of the story, taking cues of what is occurring at the moment. So listen to the feelings, thoughts, and behaviors and experience of the client now without any pre-rehearsed or any types of preconceived filters, biases, or judgments. This type of listening and basically attending your client will allow for you to make a better diagnosis, give better feedback, and show the client that you're actually interested in his or her story. So we also finally want to look, as I said, about observations from your listening. Sometimes an individual might not want to talk a lot. You'll have some in counseling sessions that will talk your ear off and they'll tell you every little detail, sometimes too much, and you'll have to actually track the conversation and keep them on pace where they need to be. However, some individuals may not want to talk as much, and you're going to have to be able to help nudge them along. And part of that involves observations. You can learn a lot from an individual just by simply listening, by following their facial expressions and their body movements. Are they turning away from you, or are they facing you directly? The tone of their voice, what emotions are being displayed. Basically, the the basic four: sad, mad, glad, or angry. What are they expressing in these tones or these expressions or these movements? Various words that are that might alarm you in terms of their severity. Also, I statements versus other statements. Sometimes individuals will speak about how they feel, and then they will use the term other to show how others are reacting to them. Those are two key words to observe. Also, for discrepancies of the client's story, such as various contradictions. Now, at this point, we're not looking to confront. That's a later step in counseling. It'll be in a further video. But these are things that you are observing, and these observations are coming from good listening, but also from just non-verbal cues. And one needs to be engaged with their client in order for these things to occur. So this is video one. It's just a basic on attending the client, showing good, empathetic, and active listening, and showing how you display yourself to a particular client so that they're more comfortable in doing so. And finally, and how we observe non-verbal cues in our client themselves. Below is our grief counseling certification. The link is below. Also, other mental health certification links are below as well for our Christian counseling, spiritual counseling, anger management, and crisis counseling. Our phone is 330-652-7776, and our email is info@aihcp.org. And one of our references for these videos that we're going to be doing for this video in particular as well is the Skilled Helper, a problem management and opportunity development approach to helping. So that is below with all the information you need if you really would like to purchase that textbook. It's a very good one in helping counselors learn a lot of the basics. And there'll be a few of these texts that we recommend in the following videos. So I'd like to thank you for listening and have a good day.